Hi, welcome to our Facebook Live event on cervical cancer. I'm Christina Annunziata from the Women's Malignancies Branch in the National Cancer Institute.
And I'm Sarah Temkin. I'm the Division Director of Gynecologic Oncology at the Massey Cancer Center in Richmond, Virginia at the Virginia Commonwealth University. And we're here today to talk about cervical cancer.
So Sarah, why don't you start out by telling us what is the cervix? Where is that in your body? What part of your body is that?
So sometimes women can actually be confused a little bit about their own anatomy, and so it's important to remember that the cervix is separate from the vagina and is actually technically part of the uterus, even though the two organs function separately, so they have different names. And the cervix functions to act as a barrier to infection so that the uterus is protected.
Exactly. So you can imagine that the first place a virus might infect, if it was attacking the female genital tract, would be in fact at the cervix part of the uterus. So what is HPV? What is human papillomavirus? Human papillomavirus is a very common virus. It is ubiquitous everywhere, and it has about 100 different strains of the virus. Only about 4 or 6 of the strains can actually cause cancer. Most of the viruses don't cause cancer. Most of the strains don't cause even genital warts and can be asymptomatic. But there are those few viruses that infect the cervix that can lead to cancer, and those are the ones that we're worried about.
We're always talking about HPV and cervical cancer together, and part of the reason for that is because nearly all of cervical cancer is caused by HPV.
Absolutely, and that leads us to screening. How can we detect HPV? Do you want to talk about screening, guys?
Yeah, so cervical cancer screening is very, very important, and it's sort of a model for how to detect disease early. Even before we knew about the HPV virus, we knew how to screen for cervical cancer, and the way that we've done that historically for decades is through the Pap smear. And by using the Pap smear, we've reduced the incidence of cervical cancer very rapidly in the United States, such that there's only about 12,000 cases per year. But the Pap smear has now even become a better test recently, as we've known about HPV, because for women over 30, the HPV test can be combined with the Pap smear to make the test work better.
And this is an important topic. Screening is something that we are going to be posting comments about in our section in the comments.
And so a woman who has an abnormal screening test, it doesn't necessarily mean that there's something wrong with you or with your cervix. It means that you need additional tests to be done. And in the case of the Pap smear and cervical cancer, that usually means having a colposcopy, which means that a microscope is pointed at the cervix, and if there are any abnormalities, a biopsy can be taken. And using the information from that procedure, a diagnosis can be made. If the cancer is diagnosed early and confined to the cervix, then usually surgery is performed as the next step. For some women, this can be fertility sparing. However, for the majority of women, this includes a hysterectomy. If the cancer has spread further when it's diagnosed, we generally refer to that as locally advanced cervical cancer, and radiation therapy is the mainstay of treatment for this type of cancer, although we will oftentimes combine chemotherapy with radiation.
And then if the cancer spreads beyond the pelvis, if it spreads beyond the immediate organs, then that's where chemotherapy is used in the front line. Chemotherapy is usually a type of chemotherapy called paclitaxel in combination with cisplatin. And in 2014, it was shown that an anti-blood vessel drug called bevacizumab actually improves survival of women with advanced stage cervical cancer, such that bevacizumab is now approved for use in front line from the FDA.
So also, when treating cervical cancer, it's important to remember that one patient may not be treated exactly the same as another one, and your doctor's going to make the ultimate decision, and combinations of different types of therapy may be appropriate for different patients.
That's a good point. There are other chemotherapies that can be used. in addition to the ones that I mentioned. But even better than actually treating advanced disease, it would be better if we could even prevent it. Can we talk about vaccine and prevention?
So cervical cancer prevention through vaccination has been sort of a hot topic this month, which is Cervical Cancer Awareness Month. And one of the reasons is that there was a statement from the cancer centers of the NCI designated cancer centers promoting its use and really saying that this is important for cancer prevention. Traditionally, the United States has sort of lagged behind behind other developed countries in terms of vaccination rates, but this year, in 2016, we had 6 out of 10 girls vaccinated and 5 out of 10 boys vaccinated.
That is great. And we can also post in comments more additional details about vaccination as well. What are the most important reasons to get girls and boys vaccinated?
So the HPV vaccination can prevent HPV infection by 9 different HPV types. 7 of those are oncogenic or cancer-causing. Those tend to be the most prevalent types of HPV that can cause cervical cancer. It's very important to remember that the vaccine should be given, if possible, before the onset of sexual activity so that a girl or boy has not yet been exposed to HPV. Some of that is about immune function in teenagers as well.
Yes, I think there have been some recent studies even that show that 2 vaccinations instead of the usual 3 can be given if it's given before the preteen years even, so well before the onset of exposure to the virus. As I mentioned before, there are human papillomavirus strains that can cause infections that don't cause cancer. There are also there's also the immune system of the person who is infected that can actually fight the virus and get rid of the virus before it causes cancer. But again, there's very, very strong evidence that these vaccines can prevent cancer.
And for girls and boys that missed the vaccine, it's still available and approved up till age 26. So it's important to remember that that you can still go ahead and give it. And besides cervical cancer, there are other kinds of malignancies that can be related to HPV.
Absolutely. The other malignancies include malignancies of the throat, also of the other parts of the GI tract. And so those can also be prevented by the vaccination. But what about if you do have cervical cancer and the cervical cancer has spread to parts of your body? We have very exciting new research going on throughout the country. As I mentioned, one of the hot topics in 2014 was the anti-angiogenic drugs, and that was actually approved based on a most recent clinical trial.
And that was an NCI-funded trial.
It was an NCI-funded trial, actually. What about some more recent trials with radiation?
Well, right now, since radiation is really the mainstay of treatment for locally advanced disease, the NCI is investigating other ways to make radiation work better. One of those ways is to add additional chemotherapy with radiation at the completion of radiation, and that's actually an ongoing international trial. There also are different agents that are being combined with radiation, and one of them is called triapine, which can affect the way that cancer cells function and their metabolism. And that trial is also currently underway and is NCI funded at various different sites within the United States.
And in the intramural program here in the NCI itself, we have several immunotherapy trials going on for cervical cancer. Actually, if you think of the way the cancer is actually started, it's started by a virus, and a virus can have effects on your immune system. So there are researchers here at the National Cancer Institute that are trying to use the immune cells actually to boost their anti-cancer function.
And then it's also important to remember that we may have other trials, or there are other trials ongoing about how to improve screening, vaccination, and quality of life for women who are affected by this disease. And those are also should be available on what is the site?
Trials.cancer.gov is where we have our link. But again, that's in the comments, and we can you can find more details there.
So if cervical cancer can be prevented or caught early, then I get one of the other questions that people ask is, why does cervical cancer still exist?
Right. So there's a lot of disparities in healthcare throughout the United States. Actually, 50% of patients who are diagnosed with cervical cancer have never had a pap smear in their lifetime. So there is that sort of lack of exposure to the healthcare system. Screening rates have been different between different groups throughout the country, and there's also issues with funding.
Well, screening rates are pretty similar between different minority populations in the United States, and there have been a lot of programs where women who may not have health insurance or access to care are able to get pap smear screening. I think some of the problem comes in follow-up and access to treatment, even though when a screening test is abnormal. We looked at the rates of cervical cancer treatments in Maryland a couple of years ago and found that actually women, underrepresented minorities, specifically black women, were 50% as likely to get surgery for cervical cancer when compared to non-black women. And so access to care is a really important question.
Yeah, so I think the more recent findings that 2 vaccines can be as useful as 3, that might help help leveling the playing field for people if they have to sort of come back less in order to get the same efficacy. To reiterate again, both girls and boys can get the vaccination, and that can help stop the development of cervical cancer and also other cancers, as we mentioned, of the head and neck and other places in the GI tract as well.
And we haven't yet seen a decline in cervical cancer or HPV-related cancers in this country, but we have, since the vaccine was approved 10 years ago, seen a decline in the rates of HPV infections, which is very promising and makes, I think, people like me who take care of women with this disease very hopeful that over time we will see a reduction in the number of cervical cancer cases in this country, because actually the rates of vaccination have not had the same levels of disparities as some of the of access to some of the screening and treatment modalities that we've had in this country. And some of that is that kids can get vaccinated at school, or they may have more access to vaccines than adults who require treatment.
And I think, the effects of the vaccine are going to take a while to be seen if we're vaccinating the young population, and then the cancer doesn't appear until later in life. We won't see those effects until maybe a decade or so.
So one thing I want to remind everybody, though, is that when we're talking about vaccination, this has not yet meant that you don't need to be screened for cervical cancer.
Oh, right.
Even though you've had the vaccine, you still need to get your pap smear, which is recommended to start at age 21, and then see your doctor and talk to your physician about any abnormal test results, because even though the HPV vaccine can prevent a lot of cervical cancer, it does not 100% it does not 100% prevent cancer.
Absolutely, absolutely. And as you mentioned, when you get the pap smear, there needs to be consistent follow-up. So let's go ahead and take some questions. I believe we have received questions from the audience. We have our first question here. Do cervical changes caused by HPV ever go away on their own?
So since most people do get HPV at some point in their life, we know that not everybody who gets an HPV, actually a minority of people who get the HPV virus will go on to develop cervical cancer. And so one way to think about this is that most people clear the HPV infection on their own by their own immune system. And so even with people who do have pap smear abnormalities or even some of the colposcopy biopsy abnormalities that we see, we recommend watching them because they can go away on their own. This is not true for high-grade cervical lesions or for cancer. Those should always be treated and taken very seriously. But it's important to remember that some of the HPV will go away on its own.
Mm-hmm. Yeah, so that is incorporated into official guidelines that your gynecologist will be able to refer to. We have them in our comments as well, and but this is something that should be an ongoing conversation with your treating doctor.
There's another question I think, Christina, you should probably answer, that's about what treatments for cervical cancer are being tested right now.
So there are many cervical cancer trials, as we mentioned, on trials.cancer.gov. And one of the ones that I highlighted before was the immunotherapy trials. That's for patients with cervical cancer that was treated initially and then has come back. That is a very exciting area and really can show a lot of promise in the immunotherapy world. There are other trials, as Sarah mentioned, to treat earlier stage disease in the initial setting, and that involves adding things to radiation or adding other drugs.
There's some trials adding immunotherapy to radiation to see if the combination of immunotherapy and radiation can do better at killing cancer cells, and may make either one of those treatment modalities more effective. And I think that's a really exciting new way that we're trying to think about advanced cancer care.
Absolutely. So I think we just received another question. Where are we for targeted therapies relating to cervical cancer? And as we mentioned, there are a number of very exciting new developments in cervical cancer. One of the ones that I mentioned earlier was the anti-angiogenesis. We also have very exciting developments in the preclinical setting and that are moving towards the clinic, which are looking at cell cycle. We didn't go into too many details about the molecular aspects of HPV, but the virus itself does have proteins that can affect the way the cell actually replicates itself.
Well, we talked about in the beginning how almost all cervical cancer has HPV involvement in it, which means that almost we can use that target. And so I think part of the question is, how do we use the target as effectively as possible? And so, this is where some of the immunotherapy can actually be sort of non-specific in some tumor types, but for HPV, it can be very, very specific. And there are new therapeutic vaccines which are being developed as well, which are vaccines to actual proteins on the cancer cells that are related to the old or active HPV infection. So some of those are very exciting as well.
Yes, very, very promising. Yes, absolutely. So we have another comment about which are the best immunotherapy drugs for cervical cancer. This is a very hot topic again. We have clinical trials ongoing that are targeting these new areas of immunotherapy that have been recently approved for melanoma, for lung cancer, and this is a way to sort of remove the suppression of the immune system that cancer can cause. Cancer can block the way the immune system functions, and these new drugs are designed to block actually remove that block and allow the immune system to come in and kill the cells irrespective of the individual proteins that we were talking about before.
Right. And there was a very exciting publication last year about using,
Last year now,
I
yes.
think last year, about using some of the therapeutic vaccines. So the difference between a preventative vaccine is that the patient gets the vaccine before they develop the disease, and a therapeutic vaccine is a vaccine that patients get after they already have the disease, and it's to augment the immune response. And so that trial, actually, that clinical trial, when it was published, revealed that some of the therapeutic vaccines are able to help the body get rid of, not cancer, this wasn't a cancer trial, but precancerous lesions in the cervix. And so that's another exciting trial that's been partially completed and should continue, which is looking at a therapeutic vaccine in a advanced cancer setting.
Yes, these therapeutic vaccines are very promising. None have been yet FDA approved, but they are in clinical trials. And again, we can find some more information on those in our comments section.
And because there's so few really good standard of care treatments for this disease, we're really excited about having patients participate in clinical trials. And it's important to ask your doctor about clinical trials or look on the NCI website to find what trials may be available to you in your area wherever you live.
So we have another question, sort of getting back to the practice of this, and I think this would be a good question for you. What age do you typically see cervical cancer being diagnosed for the first time?
So cervical cancer, this is a really good question, actually, and it's a little bit more complicated than you would think, because in different age groups can get affected by cervical cancer differently. But most likely, cervical cancer is diagnosed starting in age 40, and then will level off. The rates will level off and plateau over time. We recommend stopping cervical cancer screening at age 65. However, recently, in fact this week, there was a lot of press about a study showing that cervical cancer can continue to affect women even as they get older, and this is more pronounced in African American women than in white women. Excuse me. And so it's important to it makes us question some of our guidelines about when to stop treatment, and this is something to talk to your doctor about. Certainly, if you've had a history of an HPV infection, it may be useful to talk to your doctor about how often your screening should be performed. The screening guidelines have changed a number of times in the last decade, such that some people are able to extend their interval between pap smears, but not everybody.
Yeah, I think that's really important. It is really important to maintain a constant conversation with your doctor when you're discussing these issues about screening and prevention and detection of early cervical cancer.
All right, Tina, I got my voice back.
Okay, go ahead.
Can you, this is another question about what kinds of cervical cancer are not related to HPV. We've been talking about HPV-related cancers.
Right, so as we mentioned before, HPV-related cancers, HPV cancers of the cervix are by far the most common type of cancer that we see. There are rare types of cancer of the cervix that are not related to HPV, and these are small cell carcinoma of the cervix.
You can get a melanoma of the cervix, which always seems it's very, very rare also, and seems strange to think about non-cutaneous melanomas.
Yes, so there are mucosal melanomas, as you mentioned, that can affect the cervix, and that can also affect other parts of the female genital tract as well. Exactly like you wouldn't think of, because it's not a sun-exposed area. These types of cervical cancers have a completely different approach to treatment. Typically, they are, if they're very early, again, they can be excised with a procedure, as Sarah was talking about at the beginning. But typically, they are treated very early with chemotherapy because they tend to be chemo responsive. I'm thinking of the small cell type in particular.
And then they're always so complicated because we're so used to seeing HPV-related cervical cancers.
Yes.
I think it's probably several times a year that I treat someone with a non-HPV cervical cancer, and usually I ask for advice, and it's presented at a tumor board so that multiple different opinions can be combined, because these cases are very, very rare.
Right, and because they are so rare, we don't really have standard guidelines, and we base them on guidelines for other cancers which have this sort of same picture, which look the same, but not necessarily came from the cervix. So for example, lung cancer is the most common place to have a small cell cancer. So typically we would consider a small cell cancer of the cervix to be treated the same way as lung cancer, but as you can imagine, there's not a lot of evidence there. So it does take an ongoing, a group of people to make these decisions and make these recommendations. But that brings us to another question that we have here, which is what kinds of questions should I ask my doctor before starting treatment? Sarah, why don't you take that one?
Okay. So, I mean, I think it's always really, really important to have questions prepared for your doctor. Make sure that a family member goes with you when you talk to, or a friend goes with you, because sometimes a visit with the oncologist can be very overwhelming, you want to make sure that you ask about how this treatment is going to affect your quality of life, what the chances are that that the cancer therapy is going to be successful, if there are alternatives. And I always recommend that people see a second opinion whenever anything seems out of the ordinary, or if there are any questions that your doctor's not answering well.
I think another question that might be interesting is if you are interested in participating in a clinical trial, you might ask your doctor, are there any clinical trials available? There are clinical trials for all stages of cervical cancer, because we still have so many questions on what is actually the best way to treat it and how we can improve on the treatments that we already have.
And there may be prevention trials as well,
absolutely,
that you might qualify for also.
Okay. Great. So this was actually very enjoyable. Thank you so much. And thank you all for watching. We're going to close now. And again, we have a lot of resources available associated with this post.
Thank you.